Upon the first speaker. The first speaker for the session is Dr. Samia Esmat, and she's going to be speaking on vitiligo treatments, patients or doctor's decision. Over to you, Dr. Samia Esmat, and she's from a professor and chairman of the dermatology department at Faculty of Medicine, Cairo University, Egypt. So over to you, Dr. Samia Esmat.
Hi, everyone. I would like to welcome all of you, whether in the morning, in the afternoon, or the evening, or wherever you are from all parts of the world. And I would like you very much, you are enjoying our meeting. Actually, in spite of the rapid advances in our understanding of vitiligo pathogenesis and hence how to manage vitiligo, we still have an important point is how to deal with our patient and how our patient react to our decision. Actually, we meet the patients with confidence because we have our background of literature, research, and experience, while the patient meets us with a lot of confusion from what they read on Google, what they hear from friends, from different gossip everywhere, and from general physicians or even general dermatologists, where they always meet the phrase that vitiligo has no treatment, there is no cure for vitiligo, and that it is an untreatable disease. On the other end, they might receive those who tell them that the vitiligo can be treated in a second. Just you can treat your vitiligo in one day. This is the only cure for vitiligo. And this also is a bad end because when they go behind that opinion, they will think that vitiligo really has no cure. The only positive thing that you can find when you Google vitiligo treatment is the post of Dr. John Harris, and I thank John for that because it's really a positive thing. It tells them the truth about vitiligo and that it is a treatable disease and how they can treat it, and about the phototherapy and treatment. So it's really a positive post. The fact about the influencers, the vitiligo patients becoming influencers, actually, those people are trying to make vitiligo acceptable by patients, but they are actually marketing the idea that vitiligo is untreatable. Since they say that you love vitiligo and live with it, but this means that it is an untreatable disease. So we have to handle this opinion and not just accept marketing of this idea. When we meet the patient who's having all this confusion, we want to let them know that not all cases are the same, and we have treatment that can be tailored for each case. That's why the first visit of vitiligo is very important. We should take a special appointment for that visit and take our time to let the patient understand more about the disease and about how it can be treated, and that every patient has his own way to treat. We can tell them that we have the decision of stabilization. Maybe stabilization alone will be enough, or stabilization and repigmentation. And sometimes if the disease is early enough, we can reach even cure. Sometimes we will have to take the other way, which is depigmentation when we cannot repigment. So we want to reach a homogeneous skin color. And this will make the patient understand that we usually have a solution for every case. It's very nice to show the patient your algorithm of treatment. All of us have this algorithm, so actually, I print it, I have a print, and I show it to the patient to see the way of the treatment and the duration needed for the treatment and how this can be worked out. I mean, the time worked out. This is nice to let them pick up their place among this algorithm and see how it will go. This has two values. The first, that the patient will know what is happening, and the second is that he will know that there are other options and that not all the cases are the same, and he might be much better than others. The duration of the disease of treatment is long, and if the patient understands that, he will continue with us. Our main treatment tools are the medical treatment, phototherapy, surgery, camouflage, or depigmentation. So when we start treatment, actually, we will have a problem with each of these options. When we start with the medical treatment, topical treatments are usually accepted by the patient, especially when they have a small area. But the difficulty is in starting the oral mini-pulse corticosteroids. We all depend on them for stabilization, but actually it is usually difficult to start with. And even when we start it, it's difficult to continue for the month or 2 months or even the 6 months that we need, because it is a drug with a bad reputation. All patients do not want to receive it. And when they started, they just start to look that are gaining weight, I'm not okay, and they want to stop it. And surprisingly enough, the steroid-sparing medications are more acceptable by the patients than steroids, although we might be more hesitant when we prescribe it than the oral mini-pulse steroids. Antioxidants also are lucky because everybody takes them as food supplements, so it's okay for them. Phototherapy, our main backbone of treatment, we have many points that we have to discuss with the patient. Sometimes they are worried about the carcinogenic effect, and we have to reassure them and tell them about the latest studies that showed that its carcinogenic effect in vitiligo patients in particular are not that high, especially in dark skin, while in the fear of the patient that the contrast makes the lesions appear more when they take the phototherapy is true, and we can help them to use sunblock for normal skin, especially if they have localized areas. Keeping the patient compliant for taking phototherapy for at least 100 or sometimes 150 sessions, as we know that we might need that, needs easy access for the machine so that we can tell them to go to the nearest possible place where a phototherapy machine is present. If we can get the home device is a very good option, because all the studies done by, you can see by Dr. Hamzavi and Dr. Pandya found that the patients have better compliance when they have the home devices, but this is not actually an option because it's not present in every country. Also, the presence of insurance improves the patient compliance, so we need to discuss this with the patient and see what he can have to improve his compliance. Surgery is a lucky option because the patient usually awaits for it, and we usually keep them for a long time till they get stable so that they can do it. So there is usually no difficulty to convince the patient about the surgery option. Camouflage is helpful during treatment, and if we don't have option except doing it like tattoos for lips, for example, but not all patients accept it. Here we can have two examples. This patient refused to do a camouflage, and he was so anxious to do the treatment and be very compliant with the treatment, because I told him first, you can do the camouflage as a help during treatment. So he refused, and this made him more anxious and compliant to continue the treatment. While this lady accepted the camouflage, and it had a good result that improved her quality of life during receiving the treatment. Depigmentation is an important step which a decision that we cannot just make easy. This decision should be totally accepted by the patient because it is a one-way ticket. So once they develop depigmentation, they cannot return back. And if the pigment returns back, it is usually disfiguring. The patient should understand that he will have or she will have a totally different skin after being a skin type 3 or 4. She will become type 1, not able to tan. She will always have to avoid the sun, to wear a sunblock. This is usually not a good choice for patients who come from a country where all patients are of dark skin types, because they will look different. They will look very different than the other population. And also they will have a great change in their lifestyle. But it will be preferred in areas where we have multiple skin types, where usually the darker patients like to get fairer. Here we can have a patient that developed depigmentation. We can see the marked difference that makes the patient really different in his quality of life. But sometimes taking the decision is different. Sometimes you decide a different decision than that of the patient. Here, for example, in a patient with universal vitiligo and some few pigment remaining, and both patient and doctor here agree for depigmentation. This is another case having some depigmentation on the hands that developed only a few months ago. She heard that she can depigment, but she told me, I don't want to depigment. And I also agreed that she does not need to depigment and she can receive treatment where she had almost an 80% back of her pigment. This case was different because she has had these lesions for about 2 or 3 years. So we don't have hope for repigmentation. And although she wanted to repigment, but I showed her those photos for a patient that tried to repigment her acral lesions, and she developed this bizarre pigmentation that it looked uglier. So she was convinced, and we did the repigmentation with very satisfactory results. Sometimes large areas of depigmentation might let the patient look for total depigmentation, but if you have no acral lesions and we still have black hair, sometimes phototherapy can help to repigment totally. Patients with extensive depigmentation of the face and the neck can be helped by depigmentation, and they are usually get satisfied even if the body is pigmented. For this case, for example, he had this total vitiligo, face vitiligo and scalp for a long time. And he developed those lesions earlier, within a few months. So when he came for advice, I told him that he will probably need depigmentation, as he has periangular lesions and he has the face lesions for a long time. But he refused, and he asked for retreatment. His problem was that when he had phototherapy, he was burnt. That's why we gave non-steroidal anti-inflammatory with the phototherapy with very low escalations, and he developed almost total repigmentation with minimal areas of the depigmentation on the scalp. Also, the hands showed good repigmentation. And we come back again that when the patient follows his desire, he is very for repigmentation or depigmentation or whatever treatment he wants, he is more and more compliant. So making the patient take the decision might be a helpful way to let them be more compliant. So whether we repigment or depigment, what's important is that we have a better cosmetic shape, which improves the patient quality of life and which is accepted by the patient, which makes them satisfied. I have an idea, and I wish that we can all apply it starting this year, is that to have a message from the VIS to the vitiligo patient. We are a large number from different countries all over the world. So if we can put up a post or a link that can appear whenever a patient Googles vitiligo treatment, that shows basic information that vitiligo is a treatable disease. Even if only we have this sentence, it would be more than enough. And it also can carry the most recent updates of the treatment, but we need to put this basic information with a photo of the whole group, with signatures of the whole group. This will help the patient to know more. Whenever he Googles, he finds a message that makes them know that vitiligo is treatable. And this message should contain keywords that make it to be the top on the list of the Google search results. And it can be translated into all languages, and we can make it updated every year. I think by this way, we can help our patients in order to delete their confusion in their minds, and we can think the way we think. We can be both speaking the same language, that not all cases are the same, and we have a tailored solution for every case. And I thank you, and I thank all my colleagues at the Cairo University Vitiligo Unit of the Dermatology Department. Thank you.
So thank you so much, Dr. Samia Esmat. I think that was wonderful, and that was very pertinent also. Something that we all need in our vitiligo patients, because it's not just the treating dermatologist, but also the patient who's to be taken into confidence. So if anybody has any questions, I can see that Dr. Marwa has, her hand up, Dr. Marwa Abdullah. Do you want to ask a question, Dr. Marwa?
Actually, I had a comment. I totally agree with you, Dr. Samia, and you, Dr. Rashmi, that it is very important to spend time with the patient and to talk to the patient, even if he is a young child. Maybe young children, sometimes when you talk to them in a nice way, etc., you can encourage them and their parents to follow the treatment and to bear the length of the treatment. This is first thing. The second thing is that actually those celebrities that come out with their vitiligo, some of them, especially in our country, they say on the social media that this disease has no cure. So this has to be also managed by us. We have to counteract this. We have to educate the patients. We have to go on social media like they do and say that this is a treatable disease, and the earlier the treatment, the better the response, as shown by the study from the Dr. Samia's group. So we really need an appraisal of good words to all the patients with vitiligo all over the world.
Totally agree with you, Dr. Marwa. And then that is something we like to do. We do try to get people, who are celebrities or public figures to often speak on, Global Vitiligo Day. And I think we should continue this practice.
We just need to put a clear answer on a link on the media, so that whenever someone says vitiligo treatment, he finds an answer that vitiligo is a treatable disease. We need to do this. If we can do this every year with the VIS, we make a slide that remains all the year, and then the next year we put another one with a different shape. I think it would be very useful. I hope Patrick can help us with that.
Yeah, so I have quick questions from the box.
You should have 2 million followers. You should have 2 million followers so that people listen to you.
Yes, they will. I think
just one or two questions from the chat box. One is from Dr. Muhammad Osser, and he's complimented you for the talk, that it's a very practical and useful talk. And the question is, do you advise patients not to apply monobenzene on the eyelids? And he's also asked that, do you start depigmentation therapy in patients with acral vitiligo but limited body surface areas? They're good questions, because I would have probably asked you about this depigmentation. So would you like to take that?
Yes, about the eyelids, we did a study about the concentrations of the monobenzone, and actually 20% is a good for the face. And we can apply it when the patient is awake, because if he puts it before it sleeps, it can slip into the eyes. But we can just apply a little amount over the eyelids with a low concentration. About starting for patients with localized areas, we can depigment, but we should be cautious because if he just wants to keep the rest of the pigment inside the body, the rest parts, we should not use the cream for depigmentation. We can use the other methods, physical methods like the laser or the cryo, so that they can remove the pigment without spreading the disease.
Okay, thank you. So there's just one more question, because rest I think I will take it at the end of the session. So this is by Dr. Giovanni Leon, and he's also said, thank you, Samia, great talk. I wanted to ask you, how do you treat patients who have, I think, limited lesions? What do you think about the option of treating them with excimer laser, lamp? I think you partly answered this, plus topical tacrolimus and systemic antioxidants to stabilize the disease.
Giovanni, you mean the localized lesions of vitiligo? Or
yes, limited lesions.
Of the vitiligo. If they are early, we start with complete systemic stabilizing protocol. If they are early, but if they are late, we can just use the targeted phototherapy. I know you have much more experience than me in that.
Okay. So there have been a lot of questions, but I think, if time permitting, we'll try to take it at the end, because I can see a lot more questions. Please do stay with us. Thank you so much, Dr. Samia.
Thank you.